My name's Alex Davis. I'm one of the PAs at Summit Brain, Spine, and Orthopedics, and an alumni from the PA program here at Rocky Mountain University.
Love it.
And Dr. Cameron Martin is the president of Rocky Mountain University of Health Professions right here in Provo, Utah. And we are getting together to have a quick conversation about collaborating because the two of us have so much in common with the school and our clinic and practicing medicine in this community. If you wouldn't mind, just start by telling us a little bit about the school here and some of the values that you guys prioritize and maybe some of the mission that you guys have in place here at Rocky Mountain.
Thanks, Alex. I appreciate that. And you're not alone, by the way, in your practice. You have some other colleagues who are also graduates of RMU.
We do, yeah. Brandy Dawson was in my class. She's another physician assistant. Morgan Ungo was a couple years behind us. He's in our clinic as well with the orthopedic group. And then we've got one of our employees that's just accepted and starts into the PA program here in the next couple of weeks.
Yeah, which is exciting.
Yeah.
So our partnership with your clinic and practice is very important because one, it's a place where our graduates are thriving. Mm-hmm. And that's really one of the things that we appreciate about working here locally in the community, but also understanding that RMU is a national institution as well.
So tell me a little bit about Rocky Mountain University, maybe the mission of the university and some of the values that you guys prioritize here.
I appreciate that question very much.
Mm-hmm.
In fact, it's one of the stories I love to tell most because it's a very distinctive mission and it's one that speaks to my heart personally, which is why I chose to be here and love this institution. I summarize our mission in 5 words: to improve the human condition. And people ask, well, how do you do that? Well, 7 more words: by loving and lifting those in need. To love someone is to see them for who they are, meet them where they are, and then to lift them by the skills we teach our students to have to improve their quality of life, thus fulfilling the mission of improving the human condition. This statue right here was created by Tom Holdman. He's an artist, stained glass or glass artist here locally, but his work is globally. He created this to denote the love and lift that in the hand of those we train. In fact, if you look at our logo, there's a hand that creates the valley and the mountains. And it's those hands that we train, and also the hearts of those of our students to see people for who they are, meet them where they are, and lift them by deploying their skills to help improve their quality of life.
I really like that, and I appreciate that. And as a student, I felt that when I was here, that all of the administrators, all of the faculty really were, at that point, focused on us as future clinicians so that we would then be able to go out into the workforce and provide that type of service to the community. And it has really meshed well with our clinic because they have a similar focus. We're able to keep the patient at the center of the discussion. We're doing everything we can to keep their best interest in mind. And so I appreciate the values that you guys put in place here at the university to see that through all the way to the end. It makes an impact.
Oh, thank you for that feedback. We're trying to model that behavior and how we treat you as a student so that you can say, oh, this is how you engage with people. This is how you engage other disciplines in the care of the patient. So it's not a us versus them, but it's what do we do to help the patient and to bring in other disciplines of our other programs here, from the PA to optometry or speech language pathology, because you're all in the same room helping the same patient at different times in different ways. And to be able to collaborate and just elevate the care by knowing how to take care of one another as well as the patient is really important. So we try to make sure our business day to day models the behavior and the expectation that we hold I hope our alums will practice in their clinical experiences.
Yeah, absolutely. We have a common phrase in our office. We say many minds for better outcomes. And it really is meant to push the idea that the group effort together can produce a better result for the patient at hand. Being able to collaborate with hospital staff, nursing, physical therapy, even family members or other clinicians that have been involved in their care, and being able to come together for a common goal of taking care of the patients.
Well, one of the things, having been a patient myself, over a decade ago, I suffered a spontaneous exertional subarachnoid hemorrhage. So I was in the ICU for a month here at Utah Valley.
Yeah.
It wasn't those who were helping the PA and the nurses and the doctors and the techs. They weren't just treating me; they were treating my family. And how they saw my wife and occasionally we could bring our kids in, melted me, just because it was that idea that we're not just here for the patient, but the patient support system, the family, and I'd say, do you need anything? How are you doing? I love that type of approach. So that means it's a many minds approach. People seeing things that others may not be picking up because they're focused on another element of care.
Yeah. Mm-hmm.
So I love the fact that that's what you espouse, to have many minds to the care of the one. I think that's fantastic.
Yeah. Another thing that I've really thought was unique and special about this university and our program specifically with the physician assistant program was how innovative they are. The faculty there are really, really trying to advance the science of education and then medicine together with that, with the use of technology. And I know they were very well equipped for the pandemic that came by a couple of years ago. And I was kind of on the tail end of that, but it sounded like a pretty smooth transition as well as they got into the next few cohorts. What other ways do you feel the university is kind of leading the charge there with innovation and pushing healthcare?
Well, thank you for that question. An important element of that is that we expect our faculty to still be practicing clinicians. So they're in real time on one day a week, and then bringing that experience into the classroom and being very relevant in their instruction. That helps us keep us on our A game, if you will. We're also looking for new technologies, new understandings, and you spoke about how seamless it was during the pandemic. Well, Rocky Mountain University, when it applied for accreditation, this was back in 1998 when we were founded, over 25 years ago, online learning was a foreign concept. It was back in the dial-up days of the internet, right?
Yep, I remember.
You do? Well, that's
great. Yeah, I do remember.
I was the oldest one.
Make sure nobody else picked up the phone while you're on the internet.
Yeah, exactly. So we said we want to do online learning, so that the practicing physical therapist or nurse wanting to get their MP degree can be working in Atlanta or in Tallahassee, but working online in the evenings and then come out here for a practicum 4 days each semester, if you will, and then go back out. That was such a foreign concept to them. But we finally got that approved 10 years later, by the way. Now it's everyday concept.
Yeah.
But that's who we were, very innovative at our beginning, to say, all right, there has to be a better way.
Yeah.
And so transitioning our course curriculum to all online was not a hard thing because we were already doing that in so many ways. In fact, we have employees who live across the country, and in every meeting, it's a Zoom meeting, and we have people on the screens, and we're just very adept, if you will, of that experience. So hopefully your experience as a student, you didn't necessarily feel a hiccup because, all right, we're just shifting modalities here.
Yeah.
So keeping ourselves abreast of what that is and what's out there in the marketplace is a key point of ours to make sure we're doing. In fact, I have a dream. And what if you take the technology that's already out there, and that is, if somebody's in India or South America speaking their native tongue, and the professor here in Provo, Utah, is hearing them in English and actually even seeing them and their mouths move speaking English. And then when this instructor, she or he, speaks in English, they're hearing it in Urdu, or they're hearing it in Spanish and seeing them speak in real time. If we're going to improve the human condition, it ought not to be limited by language or geography. We need to go where the need is.
Yeah.
And so my vision is to push us towards something of that nature as an institution. Where's the need? Let's meet it. Let's help people out.
Yeah.
We could use great talent like yourself in that experience.
Yeah, absolutely.
And some people self-select themselves out of options, and I know that there's experiences here. We have 6 clinics, which we service pro bono, so free of charge to those who are indigent, homeless, refugee, undocumented. We do that because then that's a population that we're not in competition with the greater market, if you will, but also helps our students like yourself see somebody in need and you go towards them. You don't say, I'm nervous to be around somebody who may be indigent status. Like, no, we help. We go towards the need, and that's where we go. So I love that about our graduates, and they have their heart, like yours, in the right place.
Very good. Yeah, and it's been fun now on the other side of things. So an alumni and a graduate in our office, I'm able to take on a few students that were in my shoes and kind of help pass along that message. What, for you and for the school here, you're positioned right in the heart of Utah County.
Right.
We've got a lot of growth towards the north end and Lehigh and Point of the Mountain, a lot going on down south, and you guys are right in the center in the hub here, right next to a major medical facility, great healthcare around here. How are you guys engaging and interacting with all of the practicing providers in the community at large here?
Well, we try to make sure that we're present and have relationships so that they understand, hey, RMU is a great place to go for talent. Not just talent to hire, but also talent to shepherd and mentor through preceptors and things of that nature. So keeping those relationships is of the utmost importance to us. And you're right, we're uniquely, even though we are uniquely positioned, even though we are a national institution, we have students, 2/3 of our students are across the country, we play local here too. So Utah is is the fastest growing state in the union, and Utah County is one of the fastest growing counties, depending upon the day or the month, whenever they take the snapshot. So it proves to be a wise thing to have been founded here in Provo, Utah, to help meet that growing need. So as the population grows, the need for access is increasing ever more. Personally, as a patient, I have called for different medical attention and needs. Well, that's 2 months out, that's 3 months out. The reason for that is the supply of that talent is lower than the demand, and that demand is only increasing as the population grows. So we love the fact that we're here, and we are attracting students from across the country and here locally. There are a lot of parents who love the fact that we're here because their children don't have to leave the state, they can stay here, right? But by being here, we're able to help solve that workforce problem here in the state of Utah. The demand, again, for myriad of our programs, and we only offer programs that we know that there's going to be a demand. Things that are saturated and things, well, that's great, others will provide that. What are the programs we offer? Well, it's because we know that there's a demand and an ever increasing demand, or we foresee there will be more of a demand to meet the labor market needs, if you will. So being in this valley has been an amazing gift for us, if you will, to help people in need. There's an ever-growing population that needs our care.
I agree with you. I think you touched on a few key points there. The growth here is incredible. And for a reason. There's a reason to be here. There's a reason people like it, and there's a lot of those reasons.
Look at these mountains.
It's an amazing view here, actually, and the new campus has been incredible. Significant upgrades. You guys have a state-of-the-art facility here, so it's been fun to see. And as we attract more people, we appreciate great educational programs that are going to keep feeding and producing good quality providers that are going to continue to engage and benefit the community at large. I'm from here, I grew up here, so I appreciate all aspects of it.
That's great. So, Utah is known nationally as a very fertile recruiting ground for medical interested individuals. So schools from all over the country come here because you're getting a clientele, a future prospective student who's well educated, articulate, and a variety of experiences in their background that make them a really sought after commodity, if you will. Well, by us being here, we're able to keep that talent here. We just added a College of Optometry. We're enrolling our second cohort here next month. There was only 23 optometry schools in the country, and nothing in the surrounding states of this area. So we leaned into that opportunity. We're here with the 24th, but there was a lot of talent that was leaving the state. They have an option now to stay in the state. And the talent that we're bringing from out of state, they're loving it, which we need them to love, right? Because we have a need for a workforce to grow in these various disciplines. So
that's great. Yeah, I appreciate that.
So Alex, I'd love to pivot here just for a moment.
Sure,
You're a graduate of Rocky Mountain University of Health Professions in our Physician's Assistance Program. What advice do you have for students that are exploring that degree here at Rocky Mountain University, or in fact any other degree? Why Rocky Mountain University?
Yeah, there were a lot of reasons I came here. One is because of the culture that we've been talking about. I thought the faculty were great. I liked the mission and values, the location, all of these great things that we've talked about. But then also the option to integrate into this community. That's what I really wanted, being from here and having family and wanting to stay close by. I liked the idea of being able to integrate into the community. And that would be my best advice for somebody that's getting into medicine, really in any capacity, but what I'm familiar with, physician assistant, is to start building your network. There's a lot of excellent providers. I really think we have world-class healthcare right here. And so being able to get out of your comfort zone, it's okay to be uncomfortable and do something you're not used to and approach people and get to know somebody, introductions, and I think people will find everybody is very welcoming and wanting to engage, wanting to mentor, and wanting to help further every one of these ideas that we've been talking about. So my advice would be to start to engage, use the resources available, and start to get to know people.
So I'll layer in on that a little bit. Let's say a student, prospective student interested in PA, sees this video.
Yeah.
Call up, hey, Alex,
Yeah.
can I have a half hour of your time?
Yeah.
And then just meet with you and just say, what did you like? What did you not like? I mean, this was actually what I did, trying to discover what my career path.
Yeah.
I cold called individuals or used the name of somebody. Say, hey, so-and-so has referred me to you. I'm just a student. I'm a student here. I hate it when people, I'm just.
Sure.
Drop the just.
Yeah,
right. I'd call them up. So-and-so has referred me to you. Do you have 30 minutes where I could just come and have a conversation to see what it is you like about your profession? Could somebody do something like that to you?
Absolutely. And what is even better, I can one up that, is we have a system in place because we encourage that and we welcome that.
That's
we have a weekly meeting. It happens every single week where we have interdisciplinary conversations. We're not just come and meet myself and interact, but come interact with therapists and nurses and chiropractors and other physicians and surgeons. And it's dedicated time meant for that type of conversation and thing to happen.
That's fantastic. I love that you do that.
Yeah.
Because that's really exposing people to the different options and opportunities. There are people who I'm sure have I don't really know what I want to do, but I thought this, and by having a conversation, they can have what I love to say, an aha moment.
Yeah.
And I'm going to do that.
Yeah.
I think that's fantastic.
Yeah.
Any other counsel that you would give a prospective student that's in the program here at RMU?
For me, it was hard to know exactly what to expect. I think a lot of it is the fear of the unknown causes some anxiety. Haven't been through this type of rigorous formal education. The testing can be a little bit difficult. I think that causes anxiety for everybody. But really, I have full confidence and faith in the faculty and the leaders of this school and this program. I think they've done an excellent job. They prepared our cohort very well. And I think just follow the advice given and they would take great care of you.
As a patient, I love the fact that it's a rigorous experience. And I think you as a student and alum or a prospective student should appreciate you want rigor.
Yeah.
You want to know your craft.
Definitely.
Because you're training yourself to help somebody in need. Dr. Baird here at RMU talks about a collision course that unbeknownst to an individual, something is occurring in their body they're unaware of. Yet there's a student here at RMU that's training, or an alum of ours comes back and gets a PhD in something, say neurotrack or something of that nature. Well, something's happening and they're on a collision course and they don't realize it. But once that issue is manifested and they come to see somebody like you, you've been trained and prepared for that collision course. Now, they're praying for a miracle. In essence, they're praying for you. They're praying for you to love and lift them in their moment of need, to help them through this condition and heal them even. And I think that's a beautiful thing. So you're an individual who's prepared and continues to prepare to help the person who is in need. And you're on a collision course for good, hopefully, right, to help them overcome the ailment that is in their way, if you will, to a healthier life.
Yeah, I think that puts a good perspective on things. I like that.
I wish I came up with it. It was John Baird that came up with it.
Of course, of course.
He's a deep thinker.
And many other things.
Yeah.
We've talked a lot about different topics in medicine, and the preparation for what's coming, the rigorous education model, and kind of the need for quality providers in this area. How do you feel, and I'm curious as we finish up here, what your opinions and thoughts are, how do you feel that we are going to best be prepared as a group of prospective students and current students and currently practicing providers? How are we best situated and prepared for what's coming in the future?
Well, let me get my crystal ball.
Sure.
Just kidding. Well, we don't know what the future holds. However, we know what we need to do, and that is have a mindset, a growth mindset. Learn from the mistakes. Don't fret them. Understand what was going on in that situation and improve. Always be a learner. So my advice to any would-be students and continued practitioner is be curious. Thrive on the curiosity. Thrive on the question, well, what's going on here and why? What else can be done? What else, if only? And if you're asking yourself, if only I had, well, then let's answer that question. Let's partner. Right? Let's go into the biotech world and let's learn how a prosthetic can be even more of a limb, if you will, versus just something to stabilize or to get through basic function. Let's think beyond just the norm and wonder what could be. Be curious, be hungry, because the needs of the future, well, we don't know what they are necessarily, because the future has yet to unveil itself. Just think about the mind. There's so much about the mind we have yet to discover, right? So as we continue to discover bit by bit, experience by experience, then let's ask ourselves, what else could be done? So what we love here at Rocky Mountain University is that mindset of growth mindset. We want students and alum who are always asking, is there a better way? What else can we do to improve the efficacy and quality of healthcare? We think part of that is through specialization, as you become more focused on a particular discipline or aspect of healthcare, but again, working collaboratively with the many minds idea, because that blends with others who are also focusing to improve the quality of healthcare. Always keeping the attention on the patient and making sure that their needs are what are being addressed. But how do we improve those experiences one by one, if you will? So I'm excited by the future, frankly.
Yeah.
I think with individuals such as yourself who are continuing to sharpen your saw and be relevant in your field of practice, not relying on what was, but now what is and what will be, and going forward, leaning into that future, a little bit of the unknown, and answering that question, what if we did this? Yeah. So here at Rocky Mountain University, we're also trying to encourage other like organizations to be nested here on this campus, which is the former Novell campus here in South Provo. Not only are spectacular views, it's a beautiful campus, but there's space here where we want some innovative minds to come. And let's incubate some great ideas through a wet lab that we have in collaboration with the Nordic College of Osteopathic Medicine. That's a lab where we can do some primary research on body tissues or fluids and things of that nature. Let's create some of that future, right? Let's answer that question, what if? And I'm excited by the future. And we're looking at growing other programs. Again, where are the unmet needs? Yeah. Let's go towards there. What do we foresee those needs at being? So if you, as a practitioner, are saying, hey, we need somebody more specialty in this or that, that would be cool, let us know, because that's where we want to be. That's the sandbox we want to play in to help people.
Yep, I love that. Yeah, never stop improving.
Yeah.
I was sad to hear that education doesn't stop when you graduate. You got to keep learning. You got to keep going.
You may not have a final exam per se,
That's true.
But be inquisitive.
Yep.
You know, I was the doctor who helped me, my brain hemorrhage. So he described it. Here's the data set, and here you are. You're so far out of the data set, I don't know. So I would ask him questions, and he would say, "You tell me, because we need to learn from you." I loved that. Dr. Paul Gardner here in the Valley. And I love the fact that my doctor is asking me as part of the equation, if you will, of my care, how to help me survive and even thrive.
That's great.
So that's what we need.
Great.
PAs,
Yeah.
docs who are saying, talk to me,
Yep.
tell me, teach me, and then associate that with what they know. Beautiful things can happen. Miracles can happen.
Yep. I like it. I appreciate the sentiment. And I appreciate you having us down here. This has been amazing to be here and see campus and be a part, and we appreciate you taking some time to let us come by.
Well, you're welcome anytime. Welcome. And we're so excited to have you here on campus. It's our new campus, right? We've just been here since December of 22. And then we've also in Building 3 where our 6 clinics are located. So come anytime. It's been an honor to have you and your colleagues here to show you the campus since you left.
Yep.
As well as just to give you an update of what we have in store. So thank you for coming. Thank you for your time.
Yeah, you too.